Hi there, how are you? Welcome to Tingle Tattoos. So you're here for a tattoo today? Cool. Can I ask you what you're looking for? Whereabouts you're wanting the tattoo? On your face? Okay, are you sure about that? Like, I mean 1,000,000% sure. Because, as you know, tattoos are permanent. You can't just get rid of them if you don't like them. You're really sure? Okay. You've thought a long time about this. If you've thought long and hard about it, then that is not my decision to make. That is yours completely. I can just advise you. Alright, well, so you're looking to get both sides of your face done, is that right? Can I just have a look at your face? Okay. You're just wanting down the sides of your face, under your eyes. Is that right? Yeah. So the whole entire area, across here and underneath. Okay. What's inspired this tattoo? You just like to be different and stand out. That's a good enough reason for me. Okay, before we start, I just have to ask you a few questions. Nothing too serious. I just need to know that you're not allergic to anything, and firstly I need to know your age. So, you're over 18, yes? Good. Can I have a contact number for you? And can I have your next of kin? Not that that's needed, but we need to fill it out on the form. Okay. And their contact number? 2. Alright, so you're over 18, that's your contact number. Are you allergic to anything that you're aware of? Any sort of clean, like sterile wipes or anything like that, latex, anything that I could be using today? You're not allergic to anything, as far as you know. Okay. Alright, and you said you've thought a long time about this. How long roughly? About 4 years? Okay, that's pretty long. Longer than the average person, yes. Okay, so we are doing stars and moons all around, both sides. So you want just stars and moons, just mini little ones? Okay, yeah, we can do that. I'm going to just roughly dot some dots on your face just to mark out the area, just so I get a rough guidance of the space between where I need to tattoo just before I start, because I like to make sure that I know for a definite where I'm going to put them. Yeah, I don't like to rush this thing, no. So first, before we actually, could I get you to sign this for me? Sorry. There you go. Thank you. Alright, that's fantastic. Yes, so like I say, I don't like to rush these things. So before I start, I'm just going to put my gloves on, and then I'm going to dot around the face whereabouts I'm going to tattoo. So this is a semi-permanent pen, so I'm going to do the dots first, and then I'm going to sterilise your whole face area just to make sure it's nice and clean and sterile before we begin tattooing. Okay, so just keep as still as possible. If you need to sneeze or anything like that, cough, anything, please let me know before you do it. Don't hold it in and think I'll be fine, because if you sneeze while I do your face, it may ruin the whole entire thing, so please, 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 please let me know if you need to do any sort of movements, and I will stop for you, and that's fine. Okay, right, so let's have a look at you. So we'll start from, so you're wanting literally all the way around, all the way down, is that right? Okay, so let me take a side view of you first, and I'll kind of dot around from the side just so I get a good perspective of where I start. I think I'll start here and here, 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 and you want underneath the eye as well. Okay, so here, here, and here. And let me do the other side. I just want to get a good side view of you just to see that I am doing it correctly. So we'll start off here and then here and then here, 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 here and here. Okay, let me just look at that, see. Yeah, I think that's about even. Yeah, that should do. Yeah. Okay. Do you want to have a look at that? If you like to look in the mirror. Do you like the positioning? Yes? Are you sure? Are you absolutely sure? Because I want you to be completely 100%. You are. Okay, good. Right. So, are you opting for numbing cream today? Just to take the edge off. The face is quite tender, especially around the brow and the eyes. I probably would suggest that you do the numbing cream. Okay, well, let me just get my sterile wipe first, and I'm going to just wipe around the area, get it nice and clean, and then we'll go ahead and apply the numbing cream. Let it sit for a couple of seconds, and then we'll get to tattooing it. Are you having any colour in your tattoo? Are you having it just plain? So you want a black outline, yellow in the middle. Okay, that's good. Okay, let me just. Okay, then right onto here, and then we'll go in here, and that's it. Okay. Yep. I think I've got all the areas. Okay, that's that. Oops. Okay, so that's all sterile. I'm going to sterilise my gloves as well. I know they're clean on, but I always like to be extra careful. After all, we are dealing with some sensitive areas of the skin, so I would not like to be the cause of any infection. Okay, nice clean hands. Okay, let's go in with the numbing spray. Well, it's not a spray today actually, I'm using a cream. Sometimes I use spray, but this one is extra powerful. I'm not saying this to scare you, but like I said, the eye area, it's a little tender. Okay. So let's see, I'm just going to pop some on my finger, and I'm just going to dab it on your face, okay? Okay. And on your brow area. Alright, that's all covered. So I'm just going to let that sit for a second. Just let it work its magic. I'm going to put my numbing cream away now because I don't need it anymore. Right, I'm just going to go over there a second. I won't be a minute. I'm just going to check something and see if I've got all my colours ready. That one and that one. Okay, so yellow and black, yellow and black, yellow and black, yellow and black. And then I've got my mixing. Okay, I just need that one. Alright, I'm just going to mix my colours just so they're ready for you, and then we'll begin tattooing. Okay, I'm going to be wiping your face throughout the throughout the tattooing with a tissue, just so that I keep a clean area at all times. Alright, I need to get my tissues. Okay, that's that. And I can put that in the bin. I'm really sorry. That's that. That's the aftercare. That's the aftercare. I can put this away now. Pop that in there. And then I'll pop that away too. Alright, let me just get the yellow. This is yellow ink I have here. I'm just going to put some in a little tub where I'll put my tattoo gun and draw on your face. Okay, just top that up. Okay, that should do. That should do. And then I'll just get the black. There. I'm going to keep the black on this side for you and the yellow on that side. Obviously I'll start with the black outline and then we'll colour it in afterwards, okay? That should do as well, I think. I like to keep tidy as I'm working, so I'm just going to put some bits away and then I'll be back with you. It lets the cream do its job and really numb the area. How does it feel? Can you feel that? How about here? How about that? Kind of getting numb now, yes? Alright, I'm going to put these back and hopefully by the time I come back it should be completely numb. Okay, we've got our tissue. Alright, I think we should begin. Let me just feel. How does that feel? Yeah? Okay, good. Let me just see. Okay, let me just see. Get my gun. And I've got dip in this. We have actually got wireless Bluetooth guns now, which is crazy. I never thought the day would come when we would have wireless tattoo guns. It's insane. It's so much more easier for me. Okay, let's begin. I'll put that there for you. So really keep still. And again, if you need to sneeze or cough or move at all, please tell me first and I will instantly stop. Just say stop. Don't tell me what you need to do, just say stop. Okay? And again, if it's too painful, let me know. I can give you as many breaks as you need, but hopefully you shouldn't feel this because you've got the numbing cream on. Alright, so let's begin. Okay, I'm just going to hold your face while I do this. How does that feel? Good. Just want that tissue. Start in the centre. first star done. I mean, this isn't going to take that long, to be honest, where they're so small. Yeah, let's have a look. So we've got the moon next. I'm going to hold your head so that you don't move. Okay, let me just move to the side of you in a second. And this side here, another star. Okay, it actually looks really pretty. I think you have one of them faces that you can get away with anything. Not that face tattoos are at all in any way bad, they just, I couldn't personally pull face tattoos off. You've got to have one of them faces, and you so happen to have one of them, so I guess I'm just going to undo. Alright. That's that. Good. Okay. Alright, I'm just going to get a clean tissue. Alright, and one last time on this side. Right, let me just go on this side of you to start tattooing your over. Okay, so we're on a star now. Star, get the tissue, wipe your face. Okay. Alright. How is it feeling? No pain? Brilliant. So you literally can't feel a thing. So good. It's actually quite relaxing. Well, I like to try my best to make everyone comfortable, so that's good to hear. Alright, so actually we're not that far away from finishing your tattoo. I can't believe how fast it's taken. I mean, when I say finish, we have done the outlines, we just need to colour in. Yeah. So I'll just finish the last moon and then we'll get on to finna. I have this one here to do under your eye, and then this one here. Okay. Alright. So, would you like a sneaky peek, or would you like to wait till the end when it's all done? You want to wait till the end. It looks amazing. Honestly, your long-awaited tattoo has definitely been worth the wait. It's really, really nice. Wait until the colour's on it. Okay, let's get that colour done. So I'm just going to clean off my thing. Let me just get this and get this here. Okay, I'm just going to spray it down. So you definitely want colour in it, yellow, yes. Obviously colour fades after a while, so it will look really, really yellow at first, but after a few weeks to a month it will die down and it will look more like faded. But if you like, you can get the colour topped up. It's just that colour will not last when it's a yellow tone, especially. It's quite a light tone. Okay, well, I'll let you think about it. So if you want to come back and get it topped up, it's totally up to you. Okay, let me just get the yellow side. So I've got the yellow here. I'll just dip my needle in it. Tattoo gun. Okay, that should do for now. Are you ready? So good, it's so pretty. Okay, and just get in there. delicately because they're quite small, so I need to really focus on what I'm doing right now. Alright, tissue. You don't need to move, do you? You're okay, good. Alright. And I'm just going to come to the side again just to get a good look at the side angle. Sometimes I find it easier to tattoo from the side. Okay. And we'll go to this side here. And underneath we will go here and here. Okay. Okay. Good. The numbness is not wearing off, is it? Okay. Right. And let's go to this side. We're almost finished. Okay. Literally last one. Alright. Let's have a look at you. Wow. I actually can't believe how good it looks on you. It looks so good. Would you like to see? Yes? There you go. How does it look? Happy? Yes? Good. Okay, so I just need to do last finishing touches, just put some cream on it, some aftercare, and I need to wrap it up just so that it is not at risk of any infection just while it heals. You can leave the bandaging on for maybe 2 days and then take it off and start applying some cream to it yourself. I'll give you some cream to take home with you. It's just so it heals nicely and it doesn't itch too much. Sometimes tattoos can be a little itchy and we really do not want to itch it because it could take off a layer of the colour. So yeah, we don't want to do that. Let me just, I'm going to take these gloves off and put the cream on your face without the gloves now. That was just for the ink part, so it doesn't go all over my hands either. Alright, let's see. Where is that cream? Where is it? Okay, it's here. Right, so this is just some, it's basically made of avocado. It's a really good healing treatment. It's not really often used, but I find it's perfect for healing tattoos. So I'm just going to sanitize my hands before I touch your face, and then I'm just going to apply it to each of the tattoos. Where they're so small, I'm just going to dab a bit on my finger and dab it on your tattoo, and that is it. Okay, so you ready? Okay, we'll go to this side. There we go. Okay, and then up the top. Alright, how does that feel? Still quite numb. Well, once the numbing goes, you shouldn't have any pain really. So, but if you do, you're always welcome to take some sort of pain relief that you would take for a headache or anything like that, and it should work just the same. but you shouldn't have any pain. So the most pain is itchiness when it's healing, which is a pain in the bum. So other than that, you should be good. So I'm just going to wrap you up and apply the cling film around you. I'm going to try and make it as least in the way of your eyes as possible, because obviously it is right around you. Let me just get my scissors, okay? Right. Got some scissors. And I have the world's biggest cling film, because obviously working in a tattoo shop we need this all the time. So I'm going to cut some off, and I'm just going to cut it up into little bits for you, and I'll apply it to your face. So I cut it into bits. Now this is a self-adhesive one, so I should be able to just pop it onto the area and it will completely stick to you by itself. I don't need to use any sort of tape or anything. And like I say, it should last about 2 days, and it should just come off actually on its own, but if it doesn't, you can take it off yourself. Right, let's just pop some up there. And just kind of put it in sections just so it's not in your way. Some on the side of there. Okay. And some underneath your eye. Okay. Right. This one down here. Alright, above your eyebrow, just underneath your eye as well. I know, it's a bit uncomfortable, but you'll get used to it after a day or so, and then you have to take it off, so it's fine. Once you've got used to it, you literally take it off. So alright, yeah, so aftercare, basically keep that on for as long as you can, take it off, put cream on as and when you need it. Don't over cream it, but just make sure it doesn't crack or go dry, and then you'll be good, and it'll heal so fast with this cream I give you, because you can take this home. This is now yours. This will sort it out in a couple of days. To be honest, where your tattoos are so small, they will heal really fast. Yeah. Alright, let me just have one last look at you from the side and see how that looks. Yes, it's really good. And I actually think you are coping very well with the tattoo, because normally you can see it in the skin around it whether or not it's going to be irritable, but you look quite good. No redness, nothing. Maybe it was the numbing cream. Well, is there anything else I can do for you today? Would you like to book in for another tattoo? Or we also do piercings here. Maybe next time I could give you a piercing, perhaps? Your ears, maybe? Well, just let me know, okay? Anyway, it's late out there. Time has gone a little faster than I thought. So I want to wish you a really, really safe journey, and I also want to wish you sweet dreams. Good night.